Welcome to Simple Conversations, the podcast that connects humanity and helps us all learn new perspectives to living a full life. My name is Inshira Ado. Today I'm joined by a health professional, and he will be sharing his insights and perspectives on what it takes to be in the front line of the fight against COVID-19. He will share his experiences, his perspectives, and what he has to go through on a day-to-day as he provides care and stay safe.
I would want to be known by name Stay Home. Just stay home. And okay. I am privileged to be working in one of the leading health facilities in the country, and also to be working closely with some of the teams that are already working to combat the pandemic, which is already reaching us. I've also had the opportunity to be part of the volunteers who are still undergoing training to manage cases that would, or to manage persons that may be contracting the virus. And then as a social media person, I use my platform to engage people, to demystify all the myths, to educate, and then to break down any form of misinformation so that together we can all win this fight together. So that's pretty much it.
Okay, Mr. Stay at Home, thank you for joining Simple Conversations. How did you end up becoming a health professional?
So growing up, I've always wanted to do things related to religion and humanitarian stuff. So along the way, somewhere in senior high school, I've always wondered, how do I play these two roles? I mean, doing something humanitarian and then doing something related to religion. So I realized that at the end of it all, it's worked towards improving the life of one person or the other. So I kept asking, how do I get into any of these fields to do something? And then when I got the chance to senior high school, I mean, at senior high school, people who have started school already, I was so far back, I was delayed because of financial challenges and all that. So I had to step to school when it was almost a month to vacation. So when I went, I was told that, okay, most of the classes are full. But by then too, I had so much interest in visual arts. So I kept asking, how could I even improve the life of anyone through visual arts? I love pictures. I love making art. Then I was told that, okay, all these classes are full. So you have to choose between the general arts and then the science class. Then I asked about what opportunities are there for these two. Then they told me, okay, science class, you could be able to do that, progress to do this and that and that. Then I said, okay, if that is the case, give me science class. And the science class was half full. So there was still vacancy for people. And then I got the chance to join at the science class. So that is where it started. So progressed on after school. It also took me some time again to continue, all because of still this financial challenge and all that. Then I had a brother who was so committed at supporting me, and he said, okay, so what are the options? And then an auntie came in, then an auntie who is a pharmacist also came in and advised to some of the options I could choose. Then I got on to nursing because I had a choice to choose between a lab scientist, a nurse, and what have you. Then I said, okay, looking at the situation with what nurses do, the options that are there, opportunity to support humanity, then definitely I was going to go in for nursing. And so far, I don't think I've had a mind of saying that I want to do any other thing apart from helping humanity through nursing. And it's been over a decade of practice, and I'm proud to be a nurse.
Wow, wonderful. Nice story. So, when you catch a cold, you have malaria, you're unwell, you go to the hospital, and before you get to see a doctor, you get triaged by a nurse. You are
Sure.
the go-to people whenever we have challenges. Especially in these times, you're like the soldiers at the front line fighting a war on behalf of everyone. Can you give me a sense of what you feel every day you wake up and ready yourself to go to work? What's your mindset?
So for me, it's like much as it's a war, and we know that when soldiers are at war, they can actually see the enemy coming either by I mean, whichever strategy they are using. But for me, it's an unseen enemy, and you, much as you may arm yourself, you are exposed to some extent. So since this outbreak, I mean, you wake up and it's a matter of anxiety, it's a matter of uncertainty, and you don't know what is ahead. But pretty much what you have to do is to prepare yourself, to prep yourself, not just physically, but psychologically, because most often than not, the anxiety and the fear has direct impact, has direct effect on you in how you deal with some of these challenges. So for me, when I wake up in the morning, the first thing I do is going to check on conversations that is happening around. What are people saying? If I am on the ward, then I am now seeing every patient as a potential patient with who may have contracted the virus. So it's like living each day with some uncertainty, some anxiety, some amount of fear, but you would always have to counter it with psychological prep up, physical prep up, your equipment that you need to get in, capacity building, networking with colleagues to really understand what is the situation, reading journals. For me, I wake up and I read quite a number of journals. There's so much information on coronavirus now, but I had to find time and continue reading. What are the research saying? What are the findings saying? What are case management protocols saying? Has it been revised? Do I need to stay with it? And sometimes I try to even use social media to find people who have survived it and professionals who are dealing with the situation, so that if they can be able to share their experience. So it's a whole lot of things at a time, and it has a whole lot of drain on your mind and your thinking and your relationship, everything that you have to do. It's a whole lot of things, but we always have to deal with it whichever way.
So what are the ranges of emotions that you have to contend with? I mean, you talked about uncertainty, so that certainly would lead to anxiety. Beyond anxiety, do you have fears? Do you have hopes? When you get out to work.
So for our work, most often than not, hope lies in how the outcomes looks for any case you are dealing with or any person you are dealing with. So, and when the stories come out as to how many people are recovering and all that, it's cast some amount of hope for you. But then again, what is more important is you dealing with the case. It's a different thing dealing with the case and knowing the outcomes therein. That gives you more hope than what you even hear. You hear people are recovering, yes, but then again, what will be the situation when it comes to you? You're also thinking about, how can I make sure that I don't get infected? Because we hear stories of how a number of people are getting infected in their line of work. So it's like, am I going to be safe or not? Is a colleague going to be infected and likely expose me to it or not? And so that is the challenge. And then one of the key things also is the fact that you having the right to work with. If you don't have the right to, you are unable to put yourself in that position where you can be able to deal with the situation.
So apart from relying on all the training that you've received and getting out there to do something you're very passionate about, you're actually also worried about yourself and the risk of catching, this disease. How does that impact on the way you deal with, the cases and the people that you come into contact with?
I think that each day you ask yourself these questions, but it's things like being supported by the team, the kind of conversations that you have, and the equipment that you would have to use definitely position you in a way that you would be able to deal with it. So it's more of the physical and psychological tools that are available, and most of these psychological um, impacts come from things like motivation. So much as you are ready to commit to the work, is there some motivation that reassures you to some extent? So if I am going to deal with the situation and then I am not out, I'm not assured that at the end of the day, if I should encounter any accident, I am covered or I'm insured, then definitely it will be difficult for me to simply walk into a danger zone.
I earlier said that soldiers do go out to the front lines of war, but the difference between, or correct me if I'm wrong, my
Yeah,
understanding is that the soldier gets out there to go to war, signing up, fully pledging their lives to the service of the nation, and whether in health, in life, and in death.
yeah.
And so they know that this might be a day where I go and I don't come back home. Are you conditioned to wake up in the morning and go to work and also feel that you are at the front line and maybe a casualty?
Yeah, so there are instances you go through things like this and you're like, but what I can say is most often than not, there is some level of positivity in dealing in nursing or healthcare. I mean, dealing with situations like this. And let me use a critical example as to you wake up and then you go to work and you don't know the situation you are going to deal with. So you get to the ward and you are given a case to manage. You are going and you know what you are going to deal with. So the thought in your mind is, if this is an infectious disease, am I going to contract it? And if I contract it, how do I survive it? You always ask yourself, if it's an infectious disease, definitely you are wondering about whether you are going to get infected with it. And if you're infected with it, are you going to survive it or not? There's most often than not that we joke about certain things because I mean we are used to it. I mean, seeing death, managing a very critically ill person to the point of death and all that. So sometimes you just crash it. Oh, don't worry, we'll all die. So because I mean you are used to it, but deep in your mind, you are thinking about survival strategy. That even if I'm exposed to this, how am I going to survive through it? And that is the most thoughts that keeps coming into your mind. You ask, oh, people didn't survive. What about those who survived? How did they do it? And those who didn't survive, what was missing? So you try to take precautions in that regard. I mean, that fear alone put you into a position whereby you do certain things not to get yourself exposed and infected in that regard.
There's a very interesting word you used. You support. You said, you look out for some kind of support. There was a press engagement with the Minister of Information that included a psychologist who spoke, or a psychiatrist. Now, how much of that kind of support will help or helps you get through your work? Is it present? Is that kind of support available?
Sorry to disappoint you, but largely most nurses and most doctors until probably you speak to a colleague or something like that. There is nothing structured to support nurses or doctors or health workers who are directly dealing with situations like this. And I have, for some reasons, advocated for these kind of psychological prep-ups for every health worker and frontliners that will be dealing with the situation, because you realize that you go in with so much thoughts in your mind and you're wondering what could be happening, and you have to position yourself to deal with it. And so much as there's some kind of financial or some insurance and or physical insurance and all that, you would need some psychological or emotional insurance. And when you are sad, you know how much sadness or how much your mood affects your immunity, how much your mood positions you to deal with a situation. But unfortunately, even on a normal day without disease outbreaks and all that, there is no structure, there is no program like that too for nurses that deal with situations like this. Until probably sometimes when you are really broken down, that you'll be subjected to some mental health care in one of the usual mental health facility. So that is the situation. And for me, I think it's quite unfortunate that those who provide care, those who provide support for others, do not readily have these support of their own.
But you've been practicing for 10 years. Beyond all the support, it seems as though in the absence of these things, you fall on each other to keep yourselves going. What is the place of humor in the workplace? How do you ever lean on humor to get through the day, and how does that work?
So for me, I think it's always been falling on each other and then jokes and what have you. Then the other aspect also is your family. If you have a very supportive family who calls you, your mom, if you have a partner who checks up on you, if you have children who you take your inspiration and other things from, and even like good friends around who could just send you a message or call you to find out how you're doing. And also, one of the most fulfilling, I mean, that part of it is when, as a person who survives the situation, calls you and you're able to talk about it, crack a joke over it, how you went through those things. I mean, sort of not entirely humor, but sort of sort of puts you in a situation that gives you some relief and makes you uh, feel a little better, even though it doesn't go away entirely. And then in these social media times, you're connected with some of these guys who do comedy and all that. You go to their timeline and check up what's there, and then sometimes music and all that. So basically, those are the key points.
So humor, leaning on your friends, finding the lighter side to what ordinarily is not a light vocation and experience, and then falling on extended family. And is there any sort of ritual, not necessarily in the sense of rituals as we hear it? I mean, at the end of the day, when say I've been on air for a long time, I would come off and I would have a certain set of things I would always do by default, deliberately, to the point where it's become just a second nature, that I would try and find ways to decompress. When you end your shift, how do you think back to a day where you've had one of the craziest, most difficult days at work, where you probably have been emotionally shaken by some of these things. How do you decompress?
I mean, because it's become routine, so sometimes you are just used to the pain, and some of the pain just motivates you on. So if it's pain, something painful you went through, you basically have to deal with it, and now you turn that pain into some sort of gain, makes it, even though if there might not be any form of excitement in it, you just have to take it like that and walk on. And if you are fortunate, I mean, you get someone to say something nice or what, or even at the department level or the ward level, you just make fun over it.
What is your biggest hope when you go to work?
So I think one of the things is when you close from work and then you go back and then you are expecting probably a patient who is on the ward and you're expecting to see an improvement. And you go and the patient is able to smile back at you and all that. It changes everything that, oh, okay, so at least the patient is improving. So usually when a patient who is going through pain and all that, you see there is some recovery at some point. For me, that is one major hope point that really gets me on. So you get back and you realize that, oh, so the effort I put in yesterday is really working. Then of course you realize that you have done something and then you're expecting things to get better. But if not, you are actually going to be living on that edge. You're actually going to still be in that low spirits until maybe something else crosses. All right. So those, for me, that is one key thing. Aside picking petty um, support mechanisms from what I mentioned earlier, definitely seeing recovery to some extent. You are reassured and you have that rope to hold on. And sometimes too, and I've not taken notice of this, but I've also realized that when a patient goes through so much pain, endures so much pain, and finally, I mean, there is rest, and I mean, it is an unfortunate death. There are sometimes you feel that, okay, this person needed this to, after having done everything that we could. And when we look at our work, it includes taking care of the person even to a peaceful death. So sometimes you feel that, okay, so the person has now found some peace, and definitely you would find some reassurance in it. So even if after the person has died or is unfortunately passes on, then you would have to take care of the person. I mean, we call something the last offices. You perform what we call the last offices. Make sure you put the dead person, in a position whereby he could be picked up to the morgue after being certified dead by the doctor. So they are all petty things, but recovery and generally seeing the person in some kind of happy mood, better mood, peaceful mood is some of the key things that makes it of a bit fulfilling, and you have that reason to continue.
So I'd like to find out what is the thing at work that you can think of that breaks your heart the most.
If I do recall very well, and I remember when there was someone who was brought on admission and was in a very critical condition, and she got better, and then I closed from work, returned, and I didn't find her again. She's been taken away, and I thought she's been referred and all that. And colleagues say, "Oh, she passed on." When you thought you've put in all your best, when you thought you have had a good laugh with this person, only to return to find a situation like this, it only leaves you heartbroken. I mean, you have memories, you have mental pictures and all that. It only leaves you heartbroken. And one of the things also is to break the news to the family. It's something personally, over all this while, I try to avoid breaking the news to the family. I'm always quick to do it when it's a good news, but when it's a bad one, it's so difficult. When you have to look into the face of relatives, when you have to look into the face of friends and family to tell them that you have lost your loved one. I remember someone saying that if it was life anywhere, if there was someone was selling life anywhere, they would have bought it for their relative.
How does that make you feel?
Sometimes you feel terrible, but you only realize that you are a medium for health. You're a medium for recovery. You're a medium for peace. You're a medium for positive change for someone.
Mm,
And if you don't take yourself from that, so there's two things: to sympathize and empathize. If you don't adopt that empathy, and then you totally immerse yourself to judge yourself by that, then you may be broken,
mm,
may not even be able to even recover very well to deal with the next situation. Because on that same on that same lane, you are dealing with someone, there's another person too who may equally be getting better. You take that kind of positivity from. So it's a mixed bag. You're fought left, right, center with all these emotions, but you just have to be strong and then deal with it. But obviously, when people are gone, people pass on, they are not recovering, things are not changing. There is very little that you can deal with.
how optimistic are you about the fight against COVID-19 as a
Mm,
frontline health worker?
mm. So when you look at Ghana's history, I mean, dealing with some of these outbreaks, and when you look at history in general about disease outbreaks, I mean, there have been worse situations before, and it's been curtailed. When you look at Ghana, we've had instances where a disease outbreak have hit us hard, but we were able to deal with it, like cerebrospinal meningitis, you have cholera affecting thousands of people and other mortalities and all that. And in all these, we have had people who have built expertise in handling some of these things.
Mm,
So it's three things. We're looking at the expertise, the availability of equipment and the right tools, and coordination. So when I look at the expertise, they are definitely the frontliners. They are the lab scientists. They are the janitors who are going to help us deal with the situation at the core ground. Then we look at the equipment that are there, to the extent that if there are equipment, you can even train someone to join in the fight. You can have more volunteers, you can have more people to join in the fight. And the coordination. Coordination is huge, and the coordination between the leadership that are supposed to ensure that equipment and frontliners are able to deal with the situation. Because in leadership, I'm talking about the government up there at the national level. I'm talking about government at facility level, government at national and community level, all coming together, including religious leaders, traditional leaders. That coordination, if we are able to coordinate very well, in the sense that there are communicate the instructions to stay home, if we are all able to do it, even at family, you know that as a head of family, you have a role as a leader.
mm,
So if we're able to harness all these efforts, if you're able to coordinate all these leadership um, um, auxiliaries, all these leadership functions, and put them together, I believe that is where the beginning of the end is. And the experts, whichever expert is supposed to go and deal with a situation, will still need some amount of capacity building, will still need tools. So being in their right frame of mind, being motivated well, then the equipment they have to deal with it. Because trust me, there's so many solid experts around that I have known. Even if I look back at the Ebola situation, having being closely to some of these people, I see that there is no way we can deal with this situation. We have so many public health leaders who have been on the global front
mm,
dealing with even worse situations.
mm,
So if we can be able to identify these experts and bring them together to enhance capacity of the others, so nurses, the doctors are all brought together. We psych them up as much as possible. We motivate them as much as possible. Not just physical insurance, but psychological insurance, and grant them the necessary tools to deal with the situation. At this point, let the frontline, let the expert do the work. This is no time for any politicking. There is no time for looking at who is scoring more points and all that. Unconsciously, that thing may be there, but we have an unseen enemy we have to deal with, who may be in the home of someone who you are not on the same terms with. So we need all these aspects. We need all the coordination from leadership to domestic leadership to the homes and to wherever. And of course, making sure that equipment that needs to be worked with, obviously, we are able to have them and deal with the situation. I am so optimistic. But then again, we need to face the fact. We need to face the truth. We need to look at the situation on the ground, thank ourselves that this is the situation and deal with it appropriately. Because it is only when you know the truth, it is only when you know the extent of the situation, that is when you are able to deal with it. And obviously, this virus waits not for us. The virus determines the timelines. So we would have to fight and go ahead of it before we are overwhelmed by the situation.
Right. So, what's your biggest dream or desire in this period? What one thing, or maybe a few things that deep down in your heart you long to see happen?
So one of the key things, number one is, I wish I could just wake up from sleep and this was all a dream, to the extent that, to find out that, okay, this was actually a dream, it was not happening. But since each day I wake up and don't realize this thing, I think that from the point I've earlier on mentioned, putting all these efforts together, we stay very, very hopeful about the situation. We stay very, very hopeful about being able to deal with it. If it's about the outbreak, definitely we still have to commit all efforts that we have to. I remember the president mentioned the fact that we can't bring the dead back, but obviously the economy can be worked on no matter how long it takes. So let's commit everything to it. Let's put our differences behind and unite as much as possible in this fight. And for every health worker, I will challenge them that it's obvious we are in a very dire situation, and there is every little effort counts. Much as sometimes you may not have it all, let us not look at our losses. Let us look at our what we don't have. But every little effort, every reassurance that we can give each other and then people who are going through the situations. I wish I would just wake up one day and then this whole thing was like a dream. But since that is not happening, we need to brace ourselves and deal with it as much as possible.
Well, Mr. Stay at Home, thank you very much. And I like the name Stay at Home because it reminds us all to stay at home and adhere to the social distancing protocols as well as the enhanced hygiene. I'm grateful for your time and the insights you've given me and our audience into the life and work of a frontline health worker during these times. I wish you well and be safe.
Yeah, thank you. Thank you very much for sharing our story.
You've been listening to Simple Conversations with me, Inshira Ado, and I hope our conversation helps you live a fuller life. Do join us again for the next episode.